We are the connection between somebody getting hurt or sick and the diagnosis that comes from the physician. You can't see the inside of a patient, right? But with X-ray, we see all the way through, especially with all of our different modalities such as CT scanning, MRI, cardiac cath. We really can see internal structures like never before. And we're able to make diagnoses without the patient having to have like an exploratory surgery where they'd get cut open. It's way less invasive to get an X-ray type of a procedure done and get the diagnosis made from that.
One of the things we do is we have a lot of role interactions, so they'll play the role of a patient and the role of a tech. So they will get to see how it is being in the opposite shoes, so how they're going to be a patient. So they'll be transported in on a stretcher or transported in a wheelchair, put onto the table, and actually positioning one another in labs. So that gives them a good idea of what to expect when their patients are coming into the room. So, when you're staring at the ceiling being rolled in, how do you make that patient more comfortable so that once you get them onto the table, they're not afraid of having that exam done?
You definitely have to have a lot of empathy. Sometimes we can't understand why they're hurting or how they're hurting. So being empathetic in that situation, you're able to help them a lot more. Being able to train people like us that want to go into that field and be able to help the patients out. Delta has done a wonderful job building up this program. The technology that they have is so advanced here. A lot of the schools don't have the opportunity to be able to use all the technology, the phantoms, the systems, and I'm grateful that I have the opportunity to use all this technology, and it really helps us become hands-on. So when we go to clinicals, we're more prepared rather than just reading out of a book or, just doing critical thinking activities where we can actually apply it in lab.
If we don't give them hands-on, they could not possibly do it on a live patient. When we're on campus, it's really hard to say, when you do this on a patient, we can only take it so far when we're on campus with our plastic mannequins and whatnot. But once they get to the hospital and they see the impact they have on a live patient that needs this image to get a diagnosis and treatment, then they see what the impact is.
Yeah, it definitely benefits me the best because I get sort of real anxious. So I have to be able to prepare myself for high stress situations, especially in the medical field. The biggest misconception is that it's like taking pictures like photography, but radiation is in fact very dangerous. So they have to deal with it with the utmost care for the patient and also ourselves. And with the professors I have and also the equipment and X-ray rooms that we have, it's equipped me to do my job as the best of my ability. And so being here, I'm actually feel quite proud of myself right now.